Now PFAS, the forever chemicals. We covered these in the last episode when we looked at the rivers. More than a third of watercourses tested in England and Wales contain PFAS at medium or high risk levels. The River Thames has the highest PFAS concentrations in the country. A site in Glasgow recorded the second highest concentration of one PFAS compound ever found in surface water globally. Those rivers supply the treatment works that produce your drinking water. So the critical question is, how much of that contamination survives treatment and reaches the tap? In 2024, water companies carried out over 770,000 analyses for individual PFAS in England. 96% of samples fell below the detection limit. No treated water was reported in the highest risk categories. Sounds reassuring, right? But the standard itself is the problem. Britain's cumulative limit from 48 monitored PFAS is 100 nanograms per litre. The United States has set an enforceable limit of 4 nanograms per litre for the two most common PFAS compounds. Britain's threshold is 25 times more lenient than America's for the same chemicals. There are more than 10,000 known PFAS compounds. On top of that, Britain monitors for only 48 of them. And here's what really needs to sink in. There is no statutory legal limit for PFAS in English and Welsh drinking water. None. What exists is Drinking Water Inspectorate guidance. Guidance, not law. In November of 2024, Liberal Democrat MP Munira Wilson introduced draft legislation to require statutory PFAS limits. She told Parliament that there is currently no legal limit on the amount of PFAS in British drinking water, and that the River Thames in her constituency recorded PFAS concentrations 11 times above the EU safe level. As of late, the government has not legislated any of this into statute. Meanwhile, a YouGov survey found 77% of British adults believe PFAS present a significant risk to human health, and 88% believe their use should be stopped or subjected to more effective controls. PFAS do not break down. They accumulate in human tissue across a lifetime and across generations. They've been detected in breast milk. They're linked to testicular cancer, thyroid disease, increased cholesterol, liver damage, fertility problems, reduced sperm quality, and developmental complications in unborn children. Britain's drinking water limits for these compounds, they're not law, they're not enforceable, and they are 25 times more permissive than those of the United States.